A portion of today's show is brought to you by Health Diagnostic Laboratory, Inc.
Welcome back to the broadcast. You've heard us talk about the importance of preventative testing with our friends at the Health Diagnostic Lab. Today, Dr. Dall is here to talk about thyroid disease and specifically my blood work, which showed up with some thyroid issues. Welcome back, Dr. Dall.
Hello.
So, yeah, you're going to tell me how bad it is.
And actually, before we started, we were realizing that thyroid disease is pretty common because it seems like more than one of us here seems to have it.
Before I started doing this because I'm hot.
Does it get worse as you get older, your thyroid
it's just
condition?
more likely that you could develop thyroid disease. But the thing is, if you treat it, you should really, feel pretty good.
But it goes undiagnosed a lot, right?
That's the problem. So symptoms of thyroid disease: fatigue, constipation, weight gain, dry skin, sometimes hair loss. Some women, if they're having really heavy periods, that'll be a symptom. So kind of like non-specific stuff. And when you go to your doctor and you're like, I'm fatigued, depression actually is another thing.
And I had hyperthyroidism initially, so I had tremors in my hands.
Right.
My feet were swelling. I was having heart palpitations. It was terrible.
Wow. Right. Okay, so what did you learn about me? How
So
bad
when,
is it?
For you,
Am I gonna live?
it wasn't that bad actually when we talked about this when you first did your test. But you were definitely in the hypothyroid, range of things.
Okay,
so that
the
means
difference
any of
between
those symptoms.
hyper.
So hypo means you're sort of the sluggish, underactive thyroid.
Which means you kind of gain weight.
Yeah.
Because your thyroid controls your metabolism
Yep, it controls
and so many
metabolism,
other
it
things.
controls all
Don't
of
you
that.
love
right.
that you have something to blame it on now?
Thyroid.
Listen on.
Because you know what? I've been working out and I eat,
know.
well, except for that apple crumble.
Well,
but
we
anyway.
saw that apple crumble.
And the martini and beer and whatever.
Oh, yeah, okay.
Don't say that too
And the
loud.
Mexican food I had all weekend.
Besides that.
Besides that, everything's just, I should be just dropping pounds left and right.
Right. So, it takes time. It's not like you take the pill and it's not a weight loss pill,
Okay.
but it does help regulate our metabolism. The thing is, if you have autoimmune thyroid disease, which is something that I want to talk about, because if you have that, your regular thyroid test doesn't always come back abnormal. And you have all these symptoms. You're like, I know something's wrong with me. And you go to your doctor and they do this thyroid test and it's like, you're perfect, you're fine. I'm like, but I have everything. So when I talk to patients, I'm like, I want to know what you feel. I want to know all your symptoms, not just look at a number and make a decision based on that number. So then we'll do some more advanced testing and look at other parameters, additional thyroid tests that we can do, and then antibody testing, because thyroid antibody testing can actually detect whether you have this autoimmune condition that may take years before it actually shows up in the regular test. And that can really then delay diagnosis. I mean, even myself, I was in medical school when I diagnosed my own thyroid, and I'm an energetic person, and I was like drinking a whole pot of coffee to simply stay awake for a few hours in clinic. And people would say, "Oh, you're depressed, honey. You're in medical school. You just
It's
here's
stress.
an antidepressant. You're going to be okay." And the antidepressant doesn't fix your thyroid problem.
Right.
So,
Is this something
You
that
know?
men have to deal with as
Men,
well?
yes. We probably see it a little bit more commonly in women, but absolutely men can have thyroid disease too. So it's so important that we diagnose, and it's so common. Women who have thyroid disease and become pregnant can have problems in pregnancy if their thyroid's not treated and addressed.
And even problems conceiving initially,
yes,
right?
it can sometimes cause some
So-
issues with fertility and stuff.
Have you stayed on your thyroid medicine all this
I've been
time?
on Synthroid for
Synthroid,
bazillion
okay.
years, for 15, 20 years.
Okay, well, so I'm going to be honest. I was on it, and then I ran out, and I didn't get the prescription renewed, so I've been off. That's why I've been gaining weight.
The problem. So the thing with thyroid is you really don't want to stop the medication because you're definitely going to slowly move back into that zone.
did
where
I
you're
make it
feeling
worse?
crappy.
Amy,
Actually,
didn't the thyroid do something weird to you? The medication, was it the thyroid
No, that was
medication?
the testosterone.
Okay.
Yeah. No way, no for me.
No, the hormone stuff, I get a little nervous about that.
Yeah.
Does thyroid go hand in hand with some hormone abnormalities?
Well, I mean, our body is so connected. So obviously when your thyroid and your metabolism is off, the fact that hormones could also be, off and other things. But it's something that you definitely don't want to stop thyroid treatment if you've been diagnosed with a true autoimmune thyroid issue. Some people just have a transient thyroid problem because they had an illness or a virus or something that triggered something to go up with their thyroid gland, but it actually goes away. But other times, it lasts. And in most people, if they have autoimmune disease, it'll be lifelong. And you really need to treat it.
Is there a natural way to treat it besides
Everybody always wants to
Synthroid?
do natural when it comes to, well, you can do things other than Synthroid. I mean, there's different types of thyroid that's natural. And honestly, for me, I mean, Synthroid has always worked really well for me. It's easy to dose. Thyroid problems are really tough to get people on the right dose.
Yeah.
I mean, just a tiny little 0.1, 0.75 versus 0.88 can make a big
think that's
difference.
why I didn't get it renewed, because I didn't think it was making a difference.
Yeah, and you have to titrate it up. You have to start low and then gradually increase it. Otherwise, if your thyroid's been sluggish for years and then all of a sudden you take this hormone that's like, you know, puts you in the other range, you could feel pretty sick from that. So you have to go really, really slow.
Gradual.
Yeah.
And of
you
course,
find
in
the
mine,
perfect-
because it was hyper, I was taking
Yep.
methimazole, and that slowed everything down
Yeah.
to the point where it made me hypo. So now
Right,
it's
and that's
trying to
very
figure
common.
out the right balance.
So you have that autoimmune problem that started out as hyper, and now it's moving into the hypothyroidism.
So it's called that Hashimoto's.
You've been all over the map.
roller coaster.
Hashimoto's, that's
Yeah.
exactly what it's called. And the thing is, once your thyroid completely poops out, like once the antibodies pretty much attack it and it's not working anymore, it's actually easier because then you're on a steady dose of thyroid hormone and your body's not producing some and you're taking some and
Right.
it's hard to regulate. So
Right.
We're just
eventually it'll work.
complicated. We're just
We are.
complicated
We're
beings.
complicated, but we're perfect.
And we're
It was
awesome.
so, you know what though? It was
It's
so
okay.
good to finally get a diagnosis because when
Yeah.
you're for 6 months you're saying there's
Something's wrong.
wrong with
Right.
me, and people make you sound like you're crazy.
No, you're not.
Yeah,
You just need to go
so
get it taken
Absolutely.
care of. And so,
And
if you,
so, and
go
you,
ahead.
and if a regular thyroid test says you're normal and you have every single symptom known to man for thyroid disease, then you need to get some additional tests.
That's right.
Yeah. Go see you.
If you're feeling like us, all the girls here that need to get on
All of
thyroid
us.
medicine, all those symptoms, yeah, you can talk to your doctor if you're interested in getting the HDL test. We'll have Dr. Dall and her colleagues back with us each Tuesday to learn more about how their test can help you and your family. And you can get more information about the Health Diagnostic Laboratory by going to their website. It's hdllabinc.com. And you can also call them at 1-877-4HD-LABS. Good to know.
Since we have just a little bit of extra time, can we talk about your skin for a second? Because I've had people ask me
This is
about
what we really wanna know.
your skin. No, seriously, and you're in your 40s.
Yeah.
We can say that.
Yes.
And you use Retin-A on your skin, like a form of Retin-A.
Retin-A, yeah.
And
Tazerac, which is like a Retin-A.
fish oil, right?
And, well, I don't put fish oil on my skin. I
Fish oil.
eat it. I take lots of it. So.
But you've taken it for years, and I think that's
yeah,
the key.
for a
we must have-
decade, I've taken 4,000 milligrams of EPA and DHA.
It has to be the right fish oil. And we've actually done a segment on this before, so you can go back in our on our YouTube channel and search the segments that we've done with
Dr.
Dr. Dall.
Yes.
And she'll explain like exactly what you need to look for in fish oils because it's very confusing.
She's as pretty on the inside as she is on the
You
outside.
are. We love when you're here. And we love when you join us. Hope you'll be back tomorrow. We'll
And
see you
Take
then.
Charge Parenting's next. Stay tuned.
Have a great day.